During a health emergency, the public may have to act on their own behalf to learn if they have become infected by a particular virus. COVID-19 taught all of us that at-home testing is another way to help determine if you have been exposed to the virus or not. If so, what you need to do next. Once you bring the kit home, find a flat surface where you can perform the test. You will need a timer, either on your smartphone or otherwise, to help complete the test thoroughly. Carefully read the instructions before starting. Wash and sanitize your hands. Make sure they are dry before starting. Remove all of the items from the test kit box. Be sure you have all the items necessary to complete the at-home test. The Binax test kit will contain 2 tests. First, remove a test card from the pouch, making sure the blue control line is present in the result window. If the blue line is not present, do not use this card. Open the card flat on the table. The card must lay flat for the entire test. Remove the dropper bottle cap. Hold the dropper straight over the top hole on the card. Place 6 drops in the top hole. Do not let the dropper touch the card. False negative results may occur if less than 6 drops of fluid are used. Open the swab package at the stick end and take out the swab. Keep your fingers away from the swab end. Insert the entire soft tip of the swab into a nostril. Using medium pressure, rub the swab against the inside walls of your nostril, making 5 big circles. Do this for about 15 seconds. Using the same swab, repeat those steps in your other nostril. Next step, insert the swab tip into the bottom hole of the test card. Do not remove the swab. Turn the swab to the right 3 times to mix it with the fluid. Peel the adhesive line off the right side, being careful not to touch the test strip. Close the left side of the card over the swab. Press firmly on the right edge of the card to seal it. Keep the card face up on the table. Now wait 15 minutes before reading the result. Don't read the result before 15 minutes or after 30 minutes. If COVID-19 was not detected, there will be no line next to the sample space. Make sure there isn't a faint sample line. If COVID-19 was detected, a pink or purple line will appear in the sample space. Any presence of 2 lines on the results is an example of a positive result. Your test is invalid if you don't see any lines at all, a blue control line only, a pink or purple sample line only, or if the control line is blue and the sample line is pink or purple. Once you have completed the testing, throw all of the elements away. If you have any questions about your test results, contact your healthcare provider right away.